Good morning, everyone. This is Christopher D. Wright. Hope everyone's having a great morning. With me next to me is Deborah Wright.
Good morning, everyone. Chairperson of the Brooklyn Family Sports Service Advisory Council.
And Joyce.
Hi, Chris. Hi, Debbie. Good morning, everyone. Thank you for joining.
Yes, welcome to another joint meeting of the Brooklyn DD Council and the Brooklyn Advisory Council. And happy anniversary for 1 year anniversary, as we've
Yes.
been doing this for one whole year. That's why you see Brooklyn Bridge, the parachute blowing, and a little nice, beautiful swans live in Sheep's Bay, Manhattan Beach. Trying to get the nice, warm, beautiful moment. So good morning, everyone. Before we start anything, and as you know, yes, I apologize, we're starting a little late, but guess what? I want to make sure everyone gets on schedule. Housekeeping rules. Because some of us are new, some of you might say, oy vey, but guess what? We got to do it because we want to keep the meeting in order, and I've been keeping that straight. At this time, we're asking everyone to please hold on to your announcements until both speakers are done. You will see a sign later on saying you can now do your announcements. You have questions for the speakers, you can put it on the chat once the speakers are starting. So please hold on to that. To make it easy for everyone, because some people might get confused with the microphones, the cameras, or the numbers, because as you know, the numbers do change as we speak. Now, I did a little experiment on you guys. Everyone should be on mute right now, except Joyce Levin and Deborah Wright. Well, Deborah's next to me, so I'm just making that clear. Here you see on your bottom screen, which is your little box, which is called your little station. You can call it as a train station, little thing. You have this microphone should be on. If it's not on, it should be an order button, which is AUDIO. If I spell it, please hear it clearly. That's why there are two arrows. You also have a camera if you want to put it on. That's your choice. Again, it's always a good choice to use. Over here, you see this clicking on participants. Right now, you see the number 30, which is really 31 because Debbie's next to me. That is where you can click it on, and you will see, I will see your hand coming up. So let's try to remind everyone. There is a hand button. I don't have one because I am the host, but everyone else has one. You can always raise your hand as well. Also next to it, closer to the right, as I said before, is the chat thing. Some areas might have the chat in there, or it's somewhere in a more box zone. Please make sure you use that as well when it's available. And as I said again, if your microphone is not on, please make sure you look for this wording on the side of this arrow as I'm pointing. And this should be on, and this will turn into a microphone. Please make sure you use that as well. Now, I don't know if we still have phone people because they're going in and out. Reminding everyone, if you're on the phone, *6 is to mute or unmute. Again, the phone is *6 to mute or unmute. If you have a question, you can press *9 to raise your hand, and I will see that hand. So please make sure everyone, we follow these easy instructions because I will see this hand between both of you guys. So as you see, that hand's going to flash like in blue or yellow for me to see you. So that is the housekeeping rules. Before we also proceed, we need to have a few minutes of silence. As you know, we did lose some, maybe not a lot this time, but individuals, families that maybe got still sick from COVID or other health reasons. We'd like to have a few minutes of silence, so let's have at least a minute quiet. Thank you, everyone. Now, as I said before, last month we had to waive the minutes. I need to make a motion for May and April minutes, and I'm going to remind you before you say it, because I know one person's going to make a motion. I'd like to remind you there is also recording minutes as well. That is available on our on the Advisory Council website, and when we did send it out on email, you had that link. So please make sure you look at both of them. I need to make a motion for both months of minutes.
I'll make a motion, Chris.
And I'll second it.
That's fine. Thank you. So now I can just ignore this and move on to the next piece. Once again, everyone, welcome, and I'm glad she's ready. I'm going to introduce the Brooklyn DD Council. She is a famous person, and I have to brag her a little bit. And let me tell you, ladies and gentlemen, happy anniversary for Joyce Levin, either way. And she is a great chairperson, but today she's going to be wearing other skill hats, but today she is our chair. So Joyce, I gave Joyce Levin the chair of the DD Council. So you all can just do your waving or clapping.
Thank you, Chris. I'm not famous. Maybe I'm infamous, but not that famous. Anyway, I'd like to welcome everybody and thank you for joining the Brooklyn DD Council joint meeting. We have a lot to cover today and interesting presentations on some new housing options, which we look forward to. As time goes on, we know that the governor has lifted a lot of restrictions in general. The venues are reopening. However, the day programs are still waiting on updated guidance from OPWDD in relationship to their full reopening. We still have the restrictions on the vans. It's limited in the number of people that can be transported, and there's still the 6-foot distance requiring at the day program sites, which severely limits the amount of people that can be at a site at one time. And we hope to get some updated guidance soon. There was supposed to be a presentation on the CAS, which would have been June 28th, from Al Pruitt and I'm sorry, I forgot the other person's name from OPWDD. However, that had to be postponed. We're working on a new date. This was being sponsored by the 5 borough councils. Hopefully this will be the end of July. As many of you are aware, the CAS will now go into effect at some point to for funding for the agencies, and there's a lot of uncertainty as there's not a lot of clarity out there as what's going to happen and how this is going to affect an agency's ability to provide services. So stay tuned for that, but I do encourage people to, once that announcement comes out, to join that webinar because it'll be a lot of information given at that point. There's a busy summer coming up. It seems like nothing slows down for us anymore, but we hope that everybody will have time to relax and enjoy the outdoors and things that we haven't been able to enjoy in the past year. I know that Chris Treba from IAC cannot join us today as IAC is having their conference, but we're still waiting for final word on the preschool and school age funding. There were suggestions and there were letter writing campaigns, so we're hoping that that funding comes through as needed. We also just want to bring to everybody's attention, as everybody must know, there's a huge direct care DSP shortage in New York State. Agencies are struggling to hire staff. And I know this is a statewide issue that we discuss all the time. There's a huge shortage, I guess, in general now for workers, but for our agencies, for the direct support professionals, it really hits home. And it causes our staff, current staff, to have to work a lot of overtime, and which can lead to burnout. We know that OPWDD is aware of this, and we're waiting, hopefully working with us as a partner to help respond to the direct care crisis, and hopefully coming up with some of the FMAP money that might be a temporary solution. We don't know how that money is being spent yet. We know that there has to be a plan by July 4th. So again, we're hoping that we'll be able to give some kind of incentive to our direct care, direct support staff. I also just want to let people know, although many of our individuals within our programs across the board, across the state really, have been vaccinated, there still is a huge vaccine hesitancy among the direct support professionals. And I think the statistics as of today, only 38% of direct support staff have been vaccinated. I know there's a lot of public service announcements out there, agencies that have been working on their own public service announcement. Some agencies are looking at giving incentives to staff that get vaccinated, but that really is a big issue because I know we see it in my own agency. We still see staff coming up positive for COVID, and we all know how devastating COVID can be. So we continue to work with our direct support staff, of course, throughout New York State to encourage them to take the vaccine. These are some of the things that are headlining right now that are bubbling up as really important items that we will continue to work on throughout the summer. And if anyone has any questions or, Chris, I'm done with my piece.
Joyce, there's one thing before we continue. Debbie wants just to chime in what you're saying also, but also just to let everyone know, if you have a question for Joyce, the chat is now open for her questions. Joyce, just to let you, Debbie has something to add in because there was something to double team with you guys. It's good.
I also want to say I did attend IAC's MEAD conference on the issue with the direct care professionals. We have to work to get them, we have to make sure that they're on the same parity to be paid and also labeled correctly to make sure that they can get the correct funding that they need, because the job that they are doing is vital, it's so important, and we have to appreciate the hard work they do. We parents understand because we've had to do it. But we also have to let the elected officials know that these are people that help our children. And without their help, we're stuck. And we need to make sure that everyone understands that you want your, OPW puts out great guidelines that, small staff, like only 1 or 2 individuals may go here, there. But if you don't have the appropriate staff working and being in there, then we can't follow the guidelines and the mandates. In reference for the staff, please also let them know that if they don't want to do it through the agency to get the vaccine, that they can go to, like Christopher and I did it at our vaccine. We did it at the Stillwell Avenue train station. We each got a weekly Metro card, so that was an incentive to us. And check, there's a lot of places. I mean, if you get a vaccine, you get free donuts from Krispy Kreme, and I believe Dunkin' Donuts. So that's
only
just
Krispy Kreme.
Krispy Kreme. But there are other places that will give you incentive and gifts. Also, it's easier to go into a ball game or take the individual somewhere. So please. But the other thing I want to add is this. Another thing that's very important. I got an email on June 8th from the ARC, and we have to help us demolish disabled poverty. Why? What does that mean? We need, since all of our individuals, unless they become disabled adult children, because they then collect under their parents' social security number, we're in poverty. We have these wonderful, great programs to go to work, but to train people to go to work. But what happens is if you don't report it correctly or Social Security doesn't, you get penalized. So how can you go to work if they have very old, archaic rule of the way they I'm sorry, I'm sleepy, apologies. That they haven't updated any of the rules. So they have income levels that are from years ago. And every time you turn around, we need to increase SSI asset limits and income rules, eliminate the marriage penalty, ensure exercise benefits, let people out of poverty, and allow people to receive help from families without being penalized. Now, this will be, we will have this email on the website, so you can email any of the elected
Which
officials.
we have one.
We have one. I know Roxanne Pershad, your state senator, her staff is on. Please, we need to have. Before everyone tells me, oh, this is just federal. Doesn't matter. Most elected officials share offices and work with their Congress people as well as our 2 United States senators. We need to put heavy pressure to explain to them, if you want us children or people with disabilities to work, besides, of course, we need accessibility, but we need to make sure these Social Security rules are updated and do not penalize. And also, you have to raise up the income level much higher, because since our children are called adult child survivors or disabled adult child survivors, once they start collecting under their parents' Social Security, their income goes up. Only if, as long as they don't go above, and if they're working and they go above the parents, they lose that coverage, which means they will lose their Medicaid. And most of OPWDD services are paid by Medicaid. So we have to work together. Thank you.
Does anyone have any questions about this at this time? If you can think about it now, and we'll ask these questions again during. Joyce and Debbie will be also putting their special announcements on two other things later on. Do we want to do our speakers, Joyce?
Yeah, that's fine.
Yeah. Can you introduce your speakers?
Okay, first, we will have Seema. I don't see her from Block Institute.
Hello.
Hi. Okay. To talk about some exciting housing options that you have.
Good morning, everyone. My name is Semra Kaibash. I'm from the Block Institute. Block provides a variety of services, but the one that I wanted to talk to you all about today is ISS. For those of you who are not familiar with the ISS program, it is a housing subsidy that helps people pay their rent. Similar to other rent subsidies that are out there, like FEPS and Section 8, the person is expected to contribute approximately 30% of their income towards housing costs, and the subsidy helps to cover the remaining rent up to a maximum allowable amount. The struggle is that in New York City, finding an apartment that's at a reasonable rent is the hardest part. So many New Yorkers under OPWDD have been qualified for ISS or other subsidies, but they can't find apartments within their budget. So what Block Institute has done is partnered with OPWDD and an affordable housing developer in a special project to help connect individuals seeking independent, non-certified housing with affordable housing units that are available in the community. So a percentage of units at the Fountain Sea View apartment complex in Brooklyn have been set aside for people who are OPWDD eligible, who wish to live independently in the community. These are brand new buildings that have just opened, and the units available are studios and 1 bedrooms. They really are very nice, nicer than any apartment I've ever lived in. Block works as the liaison between the applicant and the management company that oversees the buildings. So we assist applicants through the typical affordable housing application process, which that does involve a full financial review. The landlord utilizes a tax credit program in order to make those units affordable. That means they have their own regulatory rules to follow to ensure that all tenants, not just OPWDD tenants, qualify for the reduced rent program. So they ask for financial documents, they ask for a lot of paperwork. So we help people collect those things and submit them to the management company to assist with that process. So who's eligible for one of these set-aside units? The person has to be over 18. They have to already be OPWDD eligible, and they have to be capable of living independently in an apartment where they are the leaseholder. Because it's non-certified, the apartment would be legally and financially in their name. If applicants intend to use an ISS subsidy through Block Institute, they would need to get their Part 1 conditional approval from OPWDD prior to applying. If people are interested, I can provide the guidance document that is out there for how to submit that Part 1 approval. But ISS is not the only subsidy available to people under OPWDD. So that means people who use self-direction or somebody has a subsidy from some other entity like FEPS, they could also qualify for one of these units. The only difference for a non-ISS applicant in the process is that once they move in, Block would not be the ISS provider. They would continue to use whatever entity that already administers their subsidy. So the best way to reach out to us if you're interested in learning more about the program or you're interested in getting the referral packet to get a name on our waiting list is to reach out to us by email. Our email address is housing@blockinstitute.org. I'm going to spell the whole thing out for you. That's HOUSING@BLOCKINstitute.org. We do also have a phone number, 347-287-9060. Please keep in mind that we get a lot of inquiries for the program, so leaving a voicemail is not the quickest way to get an answer. We do prefer you use email whenever possible. Any questions?
There is, before you continue, can you please put that information about your phone number and email on the chat, please?
Absolutely.
So then I can share it. And then once you do that, Joyce Levin, you have a question?
Yeah, I wanted to, what is the rent for the single one-bedroom apartment?
So there are 5 different buildings. 2 of them are already full. The other 3 are in process now. So the rents vary based on which units are available, but they all range around, a studio is usually around $950, and a 1-bedroom is just under $1,100, so 1,000 and change.
Okay, that would cover what ISS.
Correct. The maximum allowable amount for ISS is just over 1,300, so it falls well under the maximum allowable.
Right. By the way, that number has been the same for like 30 years. It's never changed.
I am fully aware.
So trying to find an apartment for somebody in New York City, like you said, for that amount of money is very, very difficult. So
Exactly.
kudos to you and your agency for doing this, because I'm sure it will help a lot of individuals out.
I agree. I actually agree with you, Joyce. I know everyone's putting on chat questions. Deborah's going to be next, and the person who raised their hand, Billy, you'll be next after Debbie. And then I'll be doing the chat questions after that.
Simra, this is my question. It's a combo. One, I want to know how much is 2-bedroom, and I want to know how many bathrooms are in the unit 2.
So unfortunately, we don't have any 2-bedroom units in the set-asides that we were given. We only have studios and 1-bedrooms, and those only have 1 bathroom.
What happens if it's a family that wants to move in and has 1 or 2 people OPWDD eligible?
I am right there with you. I have made the same comment, and we have had people move in with children. We've had people, there is a maximum number of people allowed by the state's capacity. So I think they can't have more than 3 in a 1-bedroom unit anyway. So it has caused some limitations in who can live in a 1-bedroom, but we have requested 2 bedrooms. Unfortunately for this particular project, they've already been set aside. They don't have any 2 bedrooms at this time.
How discriminatory.
Yeah, well, that's something you need to advocate. Billy, you had your hand up. And
Yes, sir.
Yes, before you continue, to answer your other question earlier, we're going to discuss that after the presentation. This is regarding the housing question.
Yes, it's for Block Institute for Senra.
Go ahead.
Yeah, Yeah, it's a quick question. Thank you. So I understand it's a project you're working on and what have you, whatnot. I'm like, for a person who, or a couple of individuals, let's say that, you know, they need the support at their present apartment where they're at. Do you guys have a subsidy outside of that thing that you're talking about? I don't know if my question makes
So if I'm understanding you correctly, you're asking if an ISS subsidy can be used for an apartment where somebody's already living.
right.
That is possible. At this point, Block Institute is only working on this special project, but every other ISS provider in New York City that does this kind of work could potentially assist someone with doing that. If the person gets pre-qualified using that Part 1 approval from OPWDD to receive the subsidy, then they could potentially apply that subsidy to where they are currently living.
Okay, cool. And you know, there's someone on our, you know, that we support. You know, she's a parent, she's got 2 children. You know, in a homeless kind of setting. It's like one of those homeless apartments per se. But you know, it's not an ideal place. But you know, I heard you say 1 bedroom, so they allow like 2 kids to come along with the mom in that setting at Block Institute. And what borough?
Lily, we're having a little trouble understanding what you're saying because your microphone is gumbling up. Can you speak a little clearly? I think your microphone might be too close.
Yeah, I'm sorry. I had the lid down on the Chromebook, so as it's projecting to the big screen, I think my voice got lost. Could you guys hear me better?
Much better now.
Yeah, just take your time when you're saying that question again. Just say it clearly and slowly.
Okay, there's a you know, a person we support. You know, I work for Care Design New York and Care Management, so there's a person we support, and you know, presently in a homeless apartment setting. She's a mom. She has 2 kids. Will she qualify for this type of apartment for this Block Institute project that is being worked on? And in what borough?
So the apartments are in Brooklyn.
Okay.
If you'd like, you can send us an email with your specific questions about particular individuals, and we can certainly screen them for it.
He's on mute because there was a backbeat coming back in again, and once it goes to backbeat, it goes automatically to mute.
Oh, okay. All right. Thank you so much.
No problem. Okay, let me go on to the chat questions, please. So, I'm just going to remind some people, some of you guys put your chats about the Joyce. We're going to hold that in after the speakers are done. But Joyce, I answered your question. Somebody's still asking, can you please redo your email and phone number together so they can have it again?
Sure. It's
Thank you.
housing@blockinstitute.org.
And I need the phone number.
Phone number is 347.
1 second. I'm
Don't go
typing.
too fast.
347
287
87.
9060.
As I'm putting that in the chat right now, so everyone should have gotten that. Okay, and to remind you again, let me just check. Matthew, while you guys have again said I'm not going to be speaking that because that's an OPWD question for later on. So that's not, let's stay focused on one question on that. Since we don't have any questions at this time for you at this moment, we're going to thank you and we're going to move on to the next speaker, Joyce.
And thank you.
But thank you so much. But don't leave.
Don't leave, Simra. Don't leave.
Joyce?
Okay,
Yes, hi. I'd like to introduce Orlando Mendoza also with offering some wonderful housing opportunities, and we appreciate you coming. So Orlando, I'm going to turn it over to you.
Thank you very much. So I am from Brooklyn Bureau of Community Services, and we have a new building the building's name is Sea Rise 1. It's located in Brooklyn, New York, right by the Neptune Avenue down by Coney Island, very close to public transportation and, you know, a variety of shopping centers, elementary schools, and a variety of things in the neighborhood. This particular project is a New York 1515 project. What makes it great is that, you know, it set aside dollars for services in addition to dollars for the rental aspect of it, which sometimes, you know, with developers can be a challenge. So this building is a 200 unit, fully affordable project. 72 of the units have been set aside for permanent supported housing. And of those 72, we have 17 units earmarked for OPWDD clients. The building is a combination of studios and one-bedroom apartments. Just to give you an idea of the admission criteria, the admission criteria is someone has to be at least 18 years of age. They have to meet the ESHI definition of homelessness. What that specifically means, it's a very broad definition of homelessness. So anyone, that would include anyone that is in danger of losing their housing, currently homeless, exiting, a residential school, are eligible for the housing. If at any point in time, anyone thinks they may have a candidate that may fit the criteria or they may have any questions, they can reach out to me and we'll discuss the candidate. I will share my email at the end and my phone number so that you guys have it, and you can, anyone that might be interested, you might think is a good fit, feel free to give me a call. The other criteria is the individual has to be able to live independently. So what that means is that they have to be able to take their medications independently and manage their day-to-day functions. The building will have some case management services at the ground level, but the idea is that people are able to sort of live, integrate independently in the community and live successfully. And obviously, any entitlements that they're eligible for, whether it's SSI, SSD, public assistance, we take everything. Tenants are required to pay 30% of their income, regardless of what their income is. So what happens is that we qualify the client clinically, and then our partner qualifies the client, as far as their income is concerned. So they'll get a very specific rent breakdown of what they're going to be required to pay for rent. So it's very specific and clear for the candidate. Just in terms of like what do you need to start the process. So I can send out a flyer. I can forward a flyer with the information so everyone has it. That also has my contact name and information. But particularly the package of what we're looking for is, a life plan, medical with PPD, psychological evaluation if applicable, psychosocial assessment, and level of care determination. Usually what happens is that once we receive all the information, then we schedule an interview with the prospective tenant. And then we go through a lot of the things that, clinically, or to see if they can live at this level successfully. A couple of things come out of that. This is sort of like the higher end of supported housing. So if an individual is not ready or experiencing challenges that can benefit from a different level of housing, we'll definitely make those recommendations to put them in the best place to be successful. And if they're able to meet the standard of housing at this level, then we'll obviously be accepting them. And this is permanent housing, so they can move in and live here for the rest of their lives. And obviously they can move if they like, but it's permanent housing, so it's sustainable for the course of whatever time they want to be with us. That's the extent of our project. Again, the building is going to be opening soon, so we're likely looking at probably an August 1 start date. So the building will be open, and we'll be actively interviewing and accepting tenants. And then again, I'll share my information in the chat. So if you have someone that you think might be eligible, but you're not exactly sure, please feel free to reach out to me, and we'll talk through it together and see what's the best fit for that particular individual.
What's the address of the building?
The address of the building is 270 West 33rd Street.
I know where you are. I know where
We
it
know
is.
where you are. I will tell you exactly. He's right near where Seagate begins. He's a couple, like 3-4 blocks, but
Okay.
you're the new big building. And yes, you have the B36 and they have to walk to the 74. There is shopping there, but
No, there's good shopping.
it's good shopping there because if people don't realize, on the peninsula of Coney Island, they have a couple of good supermarkets there and other stores. They're slowly rebuilding it up.
How many apartments will be available?
17.
17, okay. And how many are in the building?
200,
altogether?
the 200 unit building. It's a 200 unit building.
200 units, okay.
And let me just back up with Joyce. Excuse me. Can you please put your email or phone number, how they can reach you, so I can add it into the chat, please?
Sure.
Does anyone else have any questions? So please raise your hand or please put it in the chat, and I'm going to check quickly. Okay, to answer that question, and I just said he's going to be he's just putting his email and his phone number in to answer that question. Orlando, can I have your phone number? I'm going to type it in.
Yep. I put it in the chat. You see it.
Oh,
Six-
okay. Never mind. I got you. I got you.
Okay.
Okay. As I'm putting this in, does anyone have any questions for Orlando? Because OPWD wants to put update their report like ASAP, Joyce. So you hear me saying that on the record. Okay. Orlando, I think you answered that question. And Orlando, just remind yourself also, since you're in that Community Board 13, Joyce can vouch with me. Community Board 13 is supporting you guys on this as well as the elected officials, because I know that area very well. I can see it from my window technically, and I'm actually serious on this one. Try to keep because let me just tell you, we have to thank our elected officials on this. This is another way we advocate everyone. And I thank you, Orlando, and please stay on as well, because in case someone does have a question later on, I may still need you both. So enjoy this meeting today, because you might get I might have a surprise for you guys.
All right.
All right. So Orlando, do not leave that table or that office, because I'll tell Rose Sal to not let you move.
Okay.
All right.
All right.
But thank you.
Yeah.
Yes, I am. Joyce, I'm going to introduce our new deputy director.
Her name is Nina Grace. She's here. Nina, where are you here?
Yes, I'm here. Do you hear me, guys?
Yes, and I can see you. Can you see
Okay.
us?
Is my sound clear today? Because last
Very
time
clear.
You must
And
be.
I hope I said your name right. But
Yes,
my name's always said wrong too. They call me Grief or
And we cause
well,
grief.
certain people Grief, not
Okay,
everybody.
okay.
But Nina, please introduce and explain to everyone who you are.
Yeah.
Thank you very much.
Thank you. And thanks, Chris, for your tutorial, for your quick tutorial on how to use, how to navigate Ring Central. And thank you for inviting me today. So my name is Nina Gritze. I'm an acting deputy director at the Regional Office 4. I work with Delia Tucker and James Doherty and Michelle Giuliano, who is also a new person and joined, Michelle also joined regional office on March 1st. Today, I'm going to give you 2 quick updates about American Rescue Plan and also about the FMAP money, and also we will talk about some changes in state plan amendment. So as you know, on March 11, President Biden signed the American Rescue Plan Act of 2021. This plan, enacted by the Congress, allows New York to make critically needed one-time investments in home and community-based services. It provides qualifying states, including New York, with a temporary 10 percentage point increase to the federal medical assistance percentage, known as FMAP, for certain Medicaid expenditures for OPWDD, home and community-based waiver services from April 2021 through March 2022. So this is the 10% that Joyce, the FMAP funding that Joyce has talked about earlier. And so the FMAP is an investment opportunity for New York State to strengthen the HCBS system in response to the COVID-19 public health emergency. The goal of this funding is to increase access to waiver for Medicaid beneficiaries and to effectively protect the HCBS workforce. And this is something that we also talked about, Joyce has mentioned about the DSPs, the crisis that we have right now. We also plan to provide financial stability for HCBS waiver providers and to accelerate long-term services and supports reform under the American Rescue Plan. This increased federal funding will help to increase community living options for people with disabilities. New York State will use state funds equivalent to the amount of federal funds attributable to the increased FMAP to implement or supplement the implementation of one or more activities that will enhance, expand, or strengthen the waiver under the Medicaid program. There is a 3-year window for the use of the funds that are accrued between April 2021 and March of 2022. This is a one-time increase in funds and will not be used to initiate projects and operations that will have an ongoing need for additional funding. An initial plan for how New York State will use funds is due to CMS by the end of June. This timeline may be extended. So right now, OPWDD is working with the other state agencies on developing a New York State plan for additional FMAP funds. And as you know, OPWDD held regional forums, and we had the discussions on 507 plan that gave us an initial opportunity to hear from our many stakeholders about their ideas and how to best invest these extra funds. And there will be additional opportunity for discussions with OPWDD on how, on submission of this, of the initial plan to the CMS. So that's the update for the Rescue American Plan. The other thing that I wanted to mention is we have received the approval of the state plan amendment. In May 2021, CMS approved OPWDD proposed emergency amendment to the New York State plan affecting flexibilities for ICF operations during the COVID-19 pandemic. So this information really relates to the providers who operate ICF programs in the community. The approval, this amendment to the state plan amendment initiates supplemental payments to ICF providers to cover expenses related to providing daytime supports to ICF residents. And these payments will be retroactive to March 17, 2020. So there is additional funding that is available to the providers right now to cover their operational expenses related to the ICF operations. And in May, at the end of May, we held a webinar and to assist in understanding recent billing guidance issued to OPWDD agencies operating ICFs in response to the COVID-19 pandemic and the recent approval of the emergency state plan amendment. A recording of this webinar is available on the OPWDD website. And that is it for me for today. Do you have any questions?
Yeah, Nelia, I'm gonna start this one first question first because I gotta do first. I'm sorry, everyone, but I gotta.
Your turn.
I have to get a dip on this one. I have to tell you, I heard with you. You know, I have to say, you sound so clear, and you broke it down. And I'm a person that's trouble understanding everyone they do reports. Not Lucy, not Delia. I'm talking about in the past. It's like when people don't break it down. I love the way you broke it down, and I actually understood it clearly. I just want to say it, and I have to say, and I'm saying this as an individual. Welcome to Brooklyn.
Thank you.
Welcome. I would like, Nina, this is Deborah. Now, at this second, this one moment, I'm putting on my parent hat, okay? As a mother, I appreciate how you spoke, because when my son, who has mild auditory processing, I say mild because he did intense speech therapy his whole life. I appreciate how you broke it down so he understands. Now, back as the chair, and on the statewide, we the members of the statewide, as you know, Margaret Puddington is the chair, and I'm the rep from Brooklyn. We are working very hard to advocate to make sure the funding that you have discussed is going to be shared and used correctly, because we want to make sure that we have enough deep staff, direct care professionals to help take care of our kids. We understand about the COVID issues. We do understand, but we want to also make sure that family support programs that help our individuals and the families are kept funded as well. And also the day having the transportation issue. I know there are rules and guidelines. I'm just saying these are some of the issues we're concerned about. We will, of course, be seeing how everything can be done. And yes, I did testify for the 507 plan and put it in writing. I'm done.
Yeah, so these are two very important initiatives that, it's a 507 strategic planning that this is setting up the direction for our agency for the next 5 years. And then the influx of the funding that is coming from the federal government, those FMAP funds, it's really should help to strengthen our system. And I know this question was asked before that we were asked how much funding is FMAP fund, it will come to the OPWDD and for the FMAP, and that would be equivalent to $740 million approximately.
Yep, that's very good.
Yeah. Because we haven't.
And Nina, you're always welcome to any of our meetings. Open invitation. We always open the meetings to all staff from OPWDD. So, always. Thank you. Okay.
Thank you.
Joyce, you have a question for the young and beautiful Nelia? Nina, sorry, I got to get used to it. Sorry.
He'll get it.
No, I appreciate everything Nina had to say. Thank you so much, Nina.
But Joyce, I think you agree with me on my second motion that we definitely welcome her to Brooklyn, since we can now hear her.
Yes.
And I have to say thank you, Nelia, because the housekeeping rules, we're just trying to make sure we don't go crazy, and we want to keep the peace because so far we have no hackers or people acting inappropriate in the meeting. We just want to keep it peace and love, as Ringo Starr will say.
Right. I plan to be on in every meeting with you guys.
We appreciate, because we also do outreach, and if due to your schedule you may not be able to, we do record this and we do keep it on our website because we know how important it is, and we do this also so people who may have missed it or not sure if they heard something can see it. I have been a recording secretary in the past, but I find when you video or record, it helps so that you could go back and check. So I understand your schedules, like I understand Delia's and everyone's.
And Lucy's.
And Lucy.
And everyone else.
And I want to say I'm very pleased. I do like living in Brooklyn because I'm very happy with the staff. So I just and we are thanking you for being here. I know you have a schedule, but thank you. Nina,
I have some good questions for you. First of all, as I'm reading some of them, a lot of them saying, I've never seen so many people complimenting you so much. Huh?
You froze, Chris.
You froze.
You guys froze for a minute or two.
Okay. Thank you for warning me, Joyce.
No problem.
Just let me just say this clearly. We have received a lot of chats on the private end complimenting you and saying welcome to Brooklyn. So that's another good thing I'm seeing. There was a question from YAI Matthew. Matthew, to answer that question, if you want to unmute yourself, you can do that right now. Matthew?
Yes,
Hi,
I'm
Matthew.
here.
Do you have a question for Nina?
And it's not the one on the chat.
No, I don't have any questions at this point.
Okay.
I did ask about
That question.
the other question will be answered later.
Yeah.
Later on, and I can say you and I can talk privately. I don't want to make this question.
Yeah, of course. All right, no problem.
Okay. Does anyone have any questions for her? because Nina. Please, at this moment, since no one wants to raise their hand or didn't put another additional question on the chat, does anyone have anything you want to add?
I do.
Before we do that, Lucy Amazing, I know you were here. Do you want to say anything? Okay. Oh, we do have.
Yeah.
Hi, Lucy.
There's one
We're
reason.
glad to see you because we love your background. That's why we always ask you to come on because it makes our day. Thank
because
you.
I do have something for both of you guys. Because this is something for you, Lucy. As you everybody know, as of June 1st, you guys now, we have a new location. I thought I wanted to share a little present for you guys.
Do you like how we did it?
Wow, very nice,
You like that?
beautiful.
Chris is very talented on the computer.
Yeah, I was trying out some new graphics.
Excellent, excellent. Thank you, thank you. Just want to say hello to everyone, and I'm happy that Nina is here too. Welcome too, Nina.
Welcome. I'm very, very happy. And please, Nina and Lucy, please let the advisory council know, because I'm going to, not that the Brooklyn DD Council is not going to help, but because of the position of being on the statewide, let us know what kind of advocacy we may need to do whenever, because that's one of the roles the statewide we do to make sure that we help on PWDD so our children will continue getting great services. So that's the only thing I'm saying.
The only thing that I can say that I'm new to the regional office, but what I experience here that we deeply care, and your all these meetings are very, very important to OPWDD. So this is how we connect with you, and we have the voice in the community, and all the concerns that are being discussed or brought up at the meetings is usually we are taking these comments back, and we discuss it, and we address it. You know, that's what I wanted to say, that the work that you do is great, and thank you for doing this.
You're very welcome.
And it's always the greatest honor.
I appreciate, because as a parent, and I'm old enough. No, I'm not giving away I'm not giving my age.
And Matthew YIB, don't even say it.
I grew up during the time of Willowbrook when there were issues, and I did live in a NYCHA building with a lot of families that had children with developmental disabilities who did not go to school. And one day when the second year of my junior high, all of a sudden everybody that lived in my building was in the classroom. And it was, I mean, I was friendly with all of them, you know, but it was very, I remember parents not getting services, and then when I slowly saw what was going on, I was happy. Of course, no one plans to have a child with developmental disability, but I was glad it was there. And yes, the services, you know, more and more rules are being changed and implemented to help the families. I just want you to know that this council, as well as others across the state, we're advocating about the updating of the SSI, and especially SSDI laws and rules and regulations, because it affects the population very, very bad, especially when you want them to eventually try to work. Because we don't want to have to pay, because they make $1 more, mom or dad, Social Security number, they lose their Medicaid waivers. And that's not a good idea. So just letting you know why we're advocating that way.
All right, thanks.
No problem. Now, I did put in the chat again for the last and final time. Does anyone have any questions for the Nina or I'm going to say the both young ladies from the DDRO?
Or if not, then just type your question.
Or just tap your question. I will make sure. Nina, do you want people to if they do have a question, do you want them to still contact you?
Absolutely. I can give my email address.
You can put it on the.
Can you put it in the chat?
Because it's
yes.
Because I will say to everyone, at this moment, since everyone has moved to the new building, please, everyone,
be patient. Remember, they're getting the offices set up. They're also making sure the phone lines are working. And we're working from my apartment because of COVID rules and regulations. But anytime you need us, just call or video us, because we do have video capability on our phones.
And laptop.
and laptops. So I just want you to know that's why we're staying here waiting till everything's set up. All right?
So
With
since that no one's have any question, I know you have to run to another meeting.
I want to thank you very much.
Thank you.
We appreciate it so much. And I know you're welcome, and good luck on your next meeting.
Thank you. Thank you.
Okay.
Bye.
Thank you. Okay. Have a great morning.
Thank you. Okay, before we continue for let me just let everyone know. Everyone, I'm gonna open up the chat so you can put your announcements on. Give me a second. So I'm just making sure the announcement mode is now open. Joyce, you left out a couple of your chairperson's report. I know it was a good time to save the good part. Joyce? Joyce? Joyce Levin, you still with me or we lost Joyce? Okay, I see Joyce must have had an outage because she's not with us. But I will move on to our other business and I will try to get back to her. Okay, is everyone putting their announcements on? We will see where if Joyce comes back on. We'll give her a few minutes, but at the same time, is Gavin Miles around?
Yep. Hi, I'm here.
Yes, Gavin, can you give us your update, please?
Hi. Yep. Sure. So first, I just wanted to give a short update on a study that our bureau is doing. It is a survey or a study on IDD service utilization. And that study, we are now finishing up, but we will be providing the details of this and some of the results of this to the council chairs and the councils in the future once that's available. But to give you a little bit of information about it, it is a study of the IDD community focusing on understanding the service utilization and also unmet need and also satisfaction of services, including the impact of COVID-19 on those services. And to date, we've conducted at least 11 caregiver interviews, a focus group with providers, and 4 provider interviews. And these, I just wanted to mention, these have been extremely informative, and we're looking forward to sharing the results of that as well in the future. The second update is just the local services plan, which we have help from all the borough council chairs every year. We've already collected that information for this year, but it's a very important plan. As Chris has mentioned, it's an annual public health assessment of the entire system, looking at, what can the local government unit do to assist at the state government level. And that's currently under review by our executive deputy commissioner of mental hygiene at the health department. So it's not completed yet, but is basically very close. And thanks to everyone who's helped with that plan, the local services plan. The next update is just on COVID-19. So I want to provide a few updates. First of all, we are continuing to promote vaccination for all New Yorkers who are 12 and older. It's super important to get the vaccine. This is something that I heard Chris mentioning earlier in the meeting. I just want to also emphasize this, that if you haven't gotten the COVID-19 vaccine, to please get it. It's super important. And we are, wanting to reduce any kind of that hesitancy about the vaccine. That's one of the things that we're working on, is trying to reduce hesitancy for those who are not sure and provide as much information as possible to New Yorkers. So I'll include in the chat some information about where you can get the vaccine if you haven't yet. And a lot of our city locations have walk-ins, so you don't have to have appointments. And at our city locations, we give the Moderna vaccine, but if you're looking for Pfizer, it will tell you where to get that. And Pfizer is, of course, the one available for younger groups, 12 plus. So I can include that as well, some of those resources, and also some information about like what is the vaccine, information about some information about the dosing, the time between doses, and things like that. Overall, though, the positive side of this is that the numbers of cases of COVID in New York right now in the summer are much lower, and we are seeing declines. The last time I checked, the positive rate, which is one of the markers that we use, is about 0.97%, which is much lower relative to the past. And, on average, we're seeing 170, 200 cases a day for New York, which is much, much lower than in the past. But that being said, it's still super important to get the vaccine. So I just really want to emphasize that. And then another update we have is that we have a new Executive Deputy Commissioner for Mental Hygiene, which I wanted to announce. So our new Executive Deputy Commissioner is Dr. Chinazo Cunningham, MD, who assumed duties in our division as of June 1st, 2021. And Dr. Cunningham joins us from the Albert Einstein College of Medicine and the Montefiore Health System, where she was Professor of Medicine, Family and Social Medicine, and Psychiatry and Behavioral Sciences. And she has over 20 years experience providing care, developing programs, and conducting research with people who use drugs or are at risk for HIV. And her research really focuses on improving access to care, utilization of healthcare services, health outcomes, and particularly around opioid use disorder and medical cannabis. And she's held several different appointments as well, including Director of Homeless Medicine and the founder and director of citywide Montefiore Health Service programs. And her other focus is on the buprenorphine treatment network in the past. So she's our new Executive Deputy Commissioner, and as I said, it's great to have her on board. So those are the main updates that I have, but I want to pause as well. I want to include, first of all, some of the links into the chat I mentioned, and also for any further questions as well.
Yes, Gavin, Deborah Grive has a question, and then Joyce Levin if she has one.
Gavin.
Okay, sure.
It was Deborah who made the big announcement about the vaccines. Chris,
thank you, Deborah.
You're welcome,
you
but you forgot one other vaccine that is important. The Johnson & Johnson one for women,
yes,
for people that are in the older ages. And in fact, certain pulmonary doctors, like mine, wanted me to do that one over the other two because not everyone can handle 2 vaccines at a time. Also, the Johnson & Johnson is being done through with the MTA because I had mine done at Stillwell Avenue as well as Chris. They're still doing it at Penn Station and Grand Central. And they give you can get a
free Metro card,
7-day Metro card,
or the Long Island River or Metro North train ticket.
Train ticket. So you can get a 2 one-way free, which is a big deal, and I love that. But the other thing I would appreciate, Gavin, is if there's a lot of changes now in the New York City Department of Health and Mental Hygiene, I'd appreciate if you would, you can't put it in the chat today, please email us with who's the commissioner, who's the deputy commissioner for our division, and also the best for contacts. And I also please send back to them that when it comes to the mayor's office of persons with disabilities, we would like for them to reach out to that office so that once a month it's usually the first Friday, except if there's a holiday, they do a once a month meeting. And this would be very good because we would like to see our population represented too.
Some do at the mayor's
Some
office.
do, but we do have that, so we'd appreciate that also. And if you have any new guidelines or programs, please email it to me. Okay?
Okay, great. Thanks for that. And also, I did want to mention that we do have an in-home vaccination, which is in the chat. So if you cannot, go to one of our vaccine sites, and this is important for individuals with disabilities, you can call this number. It's for all New Yorkers with disabilities. And that particular, I'm not positive on this, but I'm pretty sure that that's the Johnson & Johnson.
It is the Johnson & Johnson.
Yeah, based upon the fact that the refrigeration requirements for Pfizer and Moderna. So that is a good option if you are not able to do a walk-in or, go to the actual site, although there are a huge number of them now, including also private sites like pharmacies and things.
And
But
Gavin,
yeah,
Gavin, before I forget, I want to ask something fast. Please also inform your bosses that we would like them to put more pressure onto HHC, which they can, because they are the governing body for healthcare. Make sure the Health and Hospitals Corporation start working more with the Article 16 and 9 clinics with the DD population, as well as PHP, because we want to make sure that, because in case, God forbid, the day you go for an emergency or see the doctor, your Medicaid could be accidentally turned off, but they'll still take care of you. And we need them to open up and act more responsible to work with our population, which I appreciate.
You cut off at the last part. You said work more with health and hospitals. You said with Article 16.
The Health and Hospitals Corporation, all the HAC hospitals, will not, and have not worked with any of the Article 16 clinics from OPW. They're under OPWDD, as well as the agencies, as well as PHP is one that handles Medicare, Medicaid. I mean, they take Medicare, they take Medicaid. Wouldn't you want to have patients that have medical insurance are covered? So please bring that up back to them for me. Thank you.
Okay.
Thank you. Joyce, do you have a question for him?
No, Chris, thanks.
Okay. Does anyone else have a question now? Say your piece. Please raise your hand or put it on the chat. Otherwise, we're going to move on. Gavin, can you stay on so in case somebody does pop in?
Yes, sure.
Thank you.
Thank you very much, Gavin. We appreciate it.
Okay. Now, Joyce is back. Let's get back to our routine, and I will get back to elected officials in just after the both chairpersons' reports. Joyce, you still have one other business in the chairperson's report, the best one.
Okay.
Someone in your exec board got an award the other day.
Oh, yes, Chris got an award from Councilwoman Matilda.
No, Assemblywoman Matilda Frantes. He's one of the, I'm helping you, Joyce. He's one of the Men of Service Community Award, and funny, he got the similar award I got this year.
Yes.
But I'm very proud of you, Christopher. Isn't that great, Joyce? He got it for all.
That's a very handsome picture.
I'll take credit because I took the picture.
And just to let you guys know, that's she did it also because I'm on the Transit Rise Council. It's representing people with disabilities for 10 years. Same time I became vice chair also. So I am celebrating a 10-year anniversary.
Time flies.
That's right, time flies when you're having fun.
Yes, and that day I had a good hair day that day.
Yeah, I wanted more peach fuzz in there.
Yeah.
Thank you, Joyce.
Congratulations, Chris.
Thank you. And I left this also because you did say it early, and I appreciate it, Joyce. I know a lot of people are going to write it. As you know, this is already on our website already. We've been mentioning, and I will say a new date to be announced in the summer of 2021 because something can always change. And as Joyce said earlier, we will let you all know. Correct, Joyce?
Yes, as soon as we know the date, it will be sent out again for everybody to register.
So all I can say is to everyone, stand by.
That's right. That's all we can say, right, Joyce?
Yes.
Yes.
And this is something for, let me just move on to, thank you. This is something for Joyce and Debbie needs to do a combo announcement for our next meeting.
Yes.
But we will talk about school in a few minutes.
We do this together then. All right. Do you want me to go first, Joyce?
Yes, please.
Okay. Everybody, we're going to do our next joint meeting, but it's on Wednesday, July 21st, 2021, but it's going to be at night on Ring Central, 5:30. The meeting starts at 6 p.m. Why? We have great news. The NYPD, that's New York Police Department, has appointed a disability service facilitator. His speaker is Michael J. Melokowski. He is now going to speak on how we can work with the police department to make sure our individuals, family members get the right help and services, and we can educate each other. So it is it's easier to get a police, if you want the police ever to be at any of your meetings, it's easier to get them at nighttime because of the different demands that's put on them. But both Joyce and I are very happy because we will have Michael J. Melokowski. He is head of the disability, comes out of One Police Plaza. So this is a big,
and his information is available on our website.
right. We did send him some information. You also can help the police department, and I'm going to speak is this. One, try to go, and they're doing it virtually. Try to go to their police council meetings. They're held now virtually. All of the precincts have a council. And it's important because they need to hear what the community thinks and feels. At the same time, it will educate you too. But if you're having problems, you can speak to them in a more safe, friendly. You don't want to go into the actual station house. The other issue is they need to understand that we have children in our population that run or may not be able to communicate. So it's a two-way street. We need to work together. Also find out which part of the sector, A, B, C, D, or E, you live in. Why? They have what's called NCO, Neighborhood Community Officers. Their role is to help you. And yes, they do help. I had an issue with cars being parked in a bus stop that I had to get off. And guess what? Got them off. So please join us on Wednesday, July 21st.
And please pass the word out to all the families.
Tell
and
everybody.
let me tell everyone, the more people come, and let me tell you, it doesn't matter if their children are on the screen. We don't care. Bring the families. We should hear them. We want to see them. We want to hear you guys as the agencies. So I'm going to say this. And yes, OPWD, we want to hope to hear from you as well. So therefore, we can work together. We want to keep some of our agencies. I already have worked with them, but we need to show examples. And by the way, August, with the other good news, National Night Out Against Crime is coming up also. So be on alert. Check your precincts when those events are coming, because that's free food, free stuff. And let me tell you, you're all going to say this. Ooh, and let me repeat that word. Free. F-R-E-E.
And if any agency you're having events or you want that, please invite your local precinct officers. That's usually the community affairs, even the captain or deputy inspector will come by, or and also safety officers. And they do have a lot of free programs that can help you. So go on their website, Facebook page, Twitter. They're on every social media.
Okay.
Okay.
Now, before anyone has any questions, I'm going to say, as Joyce will agree with me, Debbie will agree with me, please, I'm going to scream that loud and clear, because I know I'm going to be annoying, but I don't care anymore. The Reduced Fare Omni will be doing a presentation. We will have and we might have a special guest star. I am not announcing that. Who I'm going to do. You want to find out? You have to attend on July 14th. We have the morning one at 9:30. That will start at 10 to 12. And the night one, 5:30 to 6 p.m. So we have two most hot stuff coming up in July. We have the Omni Reduced Fare update information to get you ready for this fall, and the NYPD. So no excuses. It may be the summertime outside, but guess what? It's going to get hotter in the house with all these interesting topics, and tries to give you guys chances to get things accomplished. So please try to attend these two. Does anyone have any questions on these? Since I see everyone's putting their announcements in. Joyce, you have a question? Diane.
No, Chris?
No, but you know, I'm going to say something as chair of the advisory. The reason why we find this very important, and if you notice, we did ask Donna Fredrickson, who's the deputy director for paratransit outreach, to appear to come, because if there are questions that happen to pop up about Accessory, she'll be there to answer.
But not complaints.
If you have a complaint,
We will ask you. to
we
speak.
will work it out, because if you don't, because you may not want everybody to know the issue.
Yes.
And please don't kill her. She's trying to fix the problem, and she has made improvements. Because I now use Accessory at a time, and thanks to her, it has improved tremendously.
But
Now-
the only way to fix that problem, if you
Positive complaint, which means you have a complaint, it's valid, but don't
kill her.
kill her. She will be like your advocate for paratransit.
As well as Reggie Barron.
Barron
okay?
is not, no, he's from the director of Mobile Sales Reduced Fare. And Christopher, what is being allowed today?
I am going to say that for outreach update after
Yeah.
we finish.
But
that's
Mr.
not.
Barron will be there too, to
Yeah.
help if you have issues or how to reapply for or fix your reduced fare Metro card.
Okay.
Okay?
So please make sure that you're there. And I do have another surprise. She's going to. I'm not mentioning until the news update. My update after. But before we do that, I am going to ask: is our Representative Roxanne Fassad's office still with us? It's hard to see. I'm gonna look. I just saw him. Sorry.
Do we have any elected officials?
Do we have
staff
any?
on?
Okay. Do we have any elected officials that are on? Because I know we had a representative that was on.
Probably recovering from election.
Hold on.
Okay.
Okay, then otherwise, I'm going to go on to the outreach update, and then we'll go on to announcements for anyone who is dying to hear. So I am going to give you guys my little, we have some breaking good news because we got a lot of new things that's coming up. As you know, news update is always available on our website front page and on its own page. So if anyone has an event or trainings, or like as Joyce just mentioned earlier, her earlier report with Debbie, some of those information, I do put that up ASAP as soon as possible as an update to everyone to share that information. There is one rule that is also on our website, and this is for everyone, and Joyce, this relates to OPWDD, the new rules of mask. And this is good news. I'm going to use an example easily. If let's say this, if I'm outside, which I'm near Coney Island, I'm the outside stations, you do not have to wear your mask on the mezzanine or the platform because that's an outside station. And I'm going to remind you, this is federal CDC guidelines to do that. Please, the only time you have to wear your mask is on the train, on the bus, and indoor stations. Like once the train goes inside Atlantic Avenue, Barclays Center, you must wear your mask at all times. And that's including Long Island Railroad, Metro North. Once you're outside and you get off the train, you can release your mask. But I'm going to remind you, there will be undercover cops. You don't know where they're going to be or when they're going to be. I'm reminding you all, on the train, you must wear your mask or a face shield like this. I'm wearing this for a reason because A, it's covering this. Once it covers my lips, my nose, I am covered. And the NYPD actually likes this when I got it. So, and if you're an asthmatic, please wear washable masks. The CDC guidelines also reminding people who has severe asthma, you should not be wearing a paper mask. You should be wearing these kind of materials because the paper ones can damage your lungs. And whatever's stuck in there, it's the one way or the other is going to come out and it's going to hurt your lungs. Please wear washable masks. They're available at the change station booths, and then it's also for the kids' size as well. So those are the laws still. $50 it will remain if you're not wearing a mask on the bus or the train. And you know why you're not going to see cops on the bus? The camera takes the picture of you on the bus as well. So please be on alert. And another good news, as of Monday, due to a lot of advocacy groups that back me up, and I did speak to Pat Floyd. Some of you did see my picture with him. Yes. But I did get a chance to ask him this question, and I found out that as of June 21st, where the van and the bus only will accept cash. Yes, cash. The lettuce kind that has a $20 bill that may have my name on it, but no. We'll be accepting that at these locations. Remind you, you can recharge it there, but receipts, do not kill yourself on receipts. But the vending machines will still be available at train stations. You can only use the machines there. The booths can only help you up to a point, but if you want to recharge your Metro card, or say your car got damaged, recharge it at these vehicles. The vehicles information is located on our website at newmta.info. info/fare, MetroCard, bus, and van. That means you can find the locations in any of the 5 boroughs, including Westchester and up to Nassau County zones. So be on alert on that. That's another good news. So we got some victories coming back. I already mentioned Omni. Another thing everyone's been asking me also, and this is something good, as of actually today, actually in the next 4 minutes, the Transit Museum store, Grand Central one, which is the main first one, will be reopening again. It will only be open from Wednesday to Friday from the hours 11:30 to 6 p.m. And you can get that fancy mask saying, I took the train, I took the bus, I'm back. The shirt as well are available at that store as well. So please come on down to Grand Central in Manhattan on that as well. Now, as we're at Grand Central, the vaccines will still be going on until the 26th. It will be extended at this moment unless something changes. Yes, as Debbie mentioned earlier, and Gavin, this is what I'm saying now. Penn Station and Grand Central, which are the 2 most ADA accessible stations, you get a chance to get a Metro card or a Metro North or Long Island Railroad train ticket once you take the shot. They will have people on standby in case something goes wrong, and they will transport and they will make sure you're okay. You might have to wait 15 minutes on that. So thank you. Please, as a reminder, please pick up your CDC vaccine cards and make sure you have that with you at all times. You will get a free Metro card, or as I said again, a free train ticket to go. So please, everyone, please be on alert on that. And there was an announcement that somebody asked me a question, so I'm answering this now on live on video. We just found out this was approved by CDC guidelines as well as New York State. There will be one camp, which the person mentioned it 2 months ago. The Suffolk County Farms and Education Center is doing some night camps with a family. Yes, it's $225, which I think is the most cheapest thing I ever seen in my whole life. They all have different dates. You can always contact them, visit their website at Suffolk County Farms and Education Center and click on their information and find out. And please remember, I said $225. I did say $225. So it will give you guys a chance. That means the family can go, have fun that one overnight, and guess what? There's still dates, July 17th, August 21st, or September 18th. Have fun on a weekend camp trip with your family. This information is also available on our website as well. And we remind you, a film festival is continuing. There is doing a special one. As you know, some of us might already saw it, and might say, Chris, I saw you. Yes, but that was dedicated by Edith Prentice. As you know, Edith Prentice was another great advocate. She was in this meeting, spoke a couple of years ago, actually 10 years ago. Well, no, actually, I'm sorry. Yeah, it was, well, whatever. It was 10 to 8 years ago. Bottom line is they're doing another event. This one is ADA accessible, but limited, but please make sure you contact them and make sure it's this Sunday, June 27th from 5 to 7, not far from the Union Square train station as well. So these are the nice things. And remind everyone, if you have things open, agency openings, like one person already emailed me, I thank you, and it's on the chat here, so I'll copy and paste the best I can. Please make sure if you have anything coming up, because someone does do it, please make sure that you have all your information sent to me no later by this Friday, so I can add it up during on the weekend on our website. And there are other things will be coming up soon, which I'm ordered not to say today, so we're going to move on to that piece. All right, so those are everything. Do we have any elected, one last time, do we have any elected officials on here that want to say something? Because otherwise, I'm running ahead of schedule. Okay, if they are here, we'll get them on the announcement. Does anyone have your announcements? Please click on your hands up so I can go one at a time. Or I'm going to choose people one by one. Announcement time. It is time for our announcements for any agencies that have openings, events, trainings, or has a question. So that's where I'm going to have my fun time. Matthew from YAI, you're now the first victim.
Hi, Chris.
Hi.
Hi, how are you?
Good. Raise your hand, and then the next person will be Carrie Banks, followed by Sandy Neighbor.
So I would just say, you know, if you want to reach out to YAI for any questions about services, just give us a call, 212-273-6182. Our free evaluation grants for Brooklyn families restart on July 1st. And yeah, give us a call or email us, link@yai.org.
And Matthew, to answer your other question earlier, I need you to call me after the meeting.
Okay, I'll call you.
That's all I'm saying.
All right, bye.
Okay. Sandy. Sandy.
I'm here. Hi.
Okay, Carrie, too late. Sandy, okay, Carrie. Sandy, we're going to hold you. That's all right, Carrie. Don't move a muscle. Sandy, hold your spot right there. Go ahead, Carrie.
Sorry about that.
Okay. At least we're going
Hi,
to,
so I have some
losing it.
really excellent news. All of New York City's public libraries will be fully open starting in mid-July, so that's like 2 weeks from now. Tables and chairs will have returned. You can come to the libraries, browse for a book, sit down, look at it, use reference materials. Our computers are still open on limited basis, so that we're still doing social distancing. You will still need to wear a mask in the libraries, but you can finally come back to the libraries, and you can sit in groups at the table, groups that you come with. Otherwise, there are social distancing requirements. But it's great news. We've been building to this for months and months and months, and we're all really excited about it. So come on in and join us at the Brooklyn Public Library, and of course, New York Public Library and Queensborough Public Library. You'll see a press release and announcement soon, but you heard it first here.
No, I like to hear it from Carrie Banks.
There you go.
I think, and I just got a question from someone who agrees with me. Second that emotion.
I third it, and do me a favor.
Yeah.
Email my brother. I'll send you his email, please.
Okay.
Because I don't want it. If he hears from you, he believes everything you say.
Happy to email your brother.
Thank you. I'll send it later.
Okay, good. And then I just want to also say that Inclusive Services has an exciting program coming up. I know that we are all thrilled that students are going back in person in the fall. It's really exciting. It's great for the kids. It's great for the parents. Let's admit it.
Yeah.
And at the same time, there's still some anxiety and some stress around this, right? Kids by then will not have been back in school in person, many of them, for a year and a half. That's a long time in the life of a student, of a particularly young child. So I think there's, we're hearing, I'm seeing, I'm hearing, I'm talking to friends that there's a fair amount of stress around this, right? You know, how a child who went to kindergarten remotely, right, is going to school for the first time in some cases, or kids are going back to school, and, you know, maybe there were some issues when they were in school before. So all these things are kind of, you know, they're exciting, but they're also stressful. So, and producing anxiety in some kids, and frankly, some kids don't want to go back in person. So how do we deal with this, right, as parents, as professionals, kids with and without disabilities? Brooklyn Public Library Inclusive Services will be having a workshop on August 7th. I put the information in the chat. I'll put it in again. We'll have some experts, including a child psychiatrist from Woodhall Medical Center, Ruth DeRoma from Include NYC. We're hoping to have somebody from the New York City Department of Education. But to address your questions, right, how do we make get our kids comfortable with the idea of going back to school? How do we get comfortable with it, right? You know, some of us as parents are going to be letting our kids out of our sights for the first time in a year and a half.
I'll drink a lot of coffee.
Yeah, this is all good news, but that doesn't mean that that doesn't mean that it's just going to happen easily like that. So
No,
let's
it's
get
okay.
together.
I'll let him out of my sight.
Oh yeah, well he's older, right? But
Hey, don't
Excuse me, he's still my child. My
yes, I
baby.
know, but he's not 6, right? So you're a 6-year-old who's been going remote for a year and a half. You know, this is like immense. So, come, let's talk. Let's hear from some experts, some of whom are dealing with this themselves, and let's get through this together and supporting each other and primarily supporting our students. So I will put the information about that in the chat again, and thank you all for your time. Talk to you.
Carrie, just want to let you know, and you fell for it, because when I put my mug like this, and
Uh-huh.
you mentioned coffee, this is what the parents need. I need coffee.
I'm going to drink peppermint tea and relax.
Yeah, sometimes we need peppermint tea and to relax too, but yeah, it's coffee that gets me, it's caffeine that gets me through my day. I drink tea these days.
Yeah, that's why I was like, that's why you went right into that. That's why I was laughing my face off on
You're
that.
kind of small on my screen because you're still sharing, so I didn't see it. I apologize.
No, that's okay. That's the best
You
part.
know what? It's okay. We'll take pictures of our 2 coffee mugs and send it to you.
Okay, I love it. Thank you.
You're welcome. Thank you, Carrie.
So we'll see you soon at the library, and we'll see you online on August 7th to talk about going back to school.
And Carrie, just to add one thing, because I have to wear my other hat. Be on the alert for the libraries in the fall that we might be using you for your presentation on some people, how they switch from a reduced fare card to an Omni card.
Okay.
So just giving you a heads up now. Now MTA knows. I bet you by now MTA knows it. They're going to be saying, "God bless Brooklyn Public Library."
Before you do that, Chris,
I
didn't mention in my announcements that we are not going back to in-person programming yet, and our meeting rooms are not available for to use as they were in the past. When we do bring them online, there'll be more of them. But
No,
for
I
the
know
time
that.
being, we're not doing in-person programming, and we're not. People can't use our meeting rooms, but we are doing outdoor programming. So possibly, if you want to bring the MTA reduced fare MetroCard van. Or
that's not gonna happen because right now, with just let everyone know that they have a schedule.
Mhm.
Because now, as I just said earlier, they're using cash now. That's going to be a suicide mission.
Okay, so
but no, I'm just saying I'm not the one that does who's going to be doing that schedule. That will be
okay.
Omni Division. I'm just giving you one heads up that the library, you may get people asking how to do that Omni thing. Which one thing I'm going to mention to people, that information is not available. And I appreciate, Carrie, what you just said is perfect timing also, because one thing we got to remind everyone on the Omni piece, and I will say this again, you do not need to rush to switch. You got from now until I turn 40 in 2 years. So I'm giving everyone you have till 2023. So I'm reminding people, the reduced fare card will still be there. Because remember, it's each steps we have to do. We have to make sure that everything is running and testing. The only thing is available, so Carrie, you hear me? This is the late to you as well, because the library works in the city agency.
Mm-hmm.
If you have an employee card, like, that new transit credit card, whatever you guys calling it anymore, because I'm getting 4 different names, you can combine that with your Omni app. And when you're on the bus or the train, you can just go, boop.
Nice.
Or your regular credit card, boop. But it's $275, and you still get a transfer. We're not up to monthly or weeklies yet. So all I can say is to be announced.
Great.
That's one thing I'm glad you said, Carrie, because now I can sleep now for the night.
Good. I'm glad I can help you sleep, Chris.
Yes.
And
Thank you,
fortunately,
Carrie.
it's not because I'm so boring.
No, you're not bored.
No, I can tell you another borough is boring and it makes me fall asleep. It's not Brooklyn. You must be mistaking someone.
All right. Well, thank you both, and everybody have great Junes. And I hope to hear from you with your questions, and our other events are also in the chat.
Yes, and they're also on the website.
Yeah. Bye-bye.
I'll see you in a few. Sandy.
Good
Neighbor.
morning, everyone. How are you?
See, now
Good, and you?
Okay,
I want to hear you singing.
I'm good, and actually, I'm not fading out this time, which is good.
Sandy, no jinxing. Let's just get the announcement
Right.
before it does do it. Then I'll have to say jink.
Okay. My name is Sandy Naper. I'm with Adapt Community Network, and we provide family reimbursement in all 5 boroughs, assistive technology, community rehabilitation, home modifications, and we've got special education preschools in all 5 boroughs. If you'd like to learn more, please email Project Connect at adaptcommunitynetwork.org or call 1-877-827-2666. Thank you very much.
Okay. Thank you, Sandy. Can you all hear me? Who next has a question or announcement? Please raise your hand. Let's see. So far, I don't see anybody. Okay. Oh, one other thing, I'm making this announcement. I hope everyone was able to vote yesterday or did participated in early voting, as well as if you participate by absentee ballot. I just hope everybody exercised their right to vote, because that is one of the biggest gifts that we have by living in this country. So with that, now Christopher, let's see. Sandy was the last person. I don't think
No,
anybody
hold
else.
on. Stop.
I'm looking for the hands.
Okay. Does any other agency has an announcement? Please unmute yourselves at this time. I know I saw.
Good morning. I have an announcement.
Oh, go ahead, Nina. Go ahead.
I'm Maricela Nunez from Synergia Family Reimbursement, and
Yes.
we still have available funds for the boroughs of Brooklyn, Manhattan, and Queens. We're down to our last 5 days. If anyone is interested, they could call me at 212-643-2840, extension 364. And my email, I'm sorry.
No, go ahead.
My email address is mnunez@synergiany.org. Thank you.
Nunez, there was a question for you. Because there was a question from a person which I can't say their name, and I know that they're going to be happy when I'm going to add in. You still have housing at this time?
Yes, sir, we do.
Okay, because there was someone who was asking me that question on the chat, and I said to them, I will save that later on to announcements. So if you have that information, can you please put that on the chat as well?
Yes.
Thank you so much.
Thank you.
And if you see some of your staff there, tell them that Brooklyn says hello.
Okay, I will. Thank you.
Viola.
Hi, good morning, everyone. Thank you for having me. I just want to announce that New York Lawyers is still open. If you have any legal, if you are in need of legal assistance, our services are for free. We don't charge anything for our legal representations. I just want to highlight today that on July 14 from 10 to 12, I'll be having a Know Your Rights special education workshop totally in Spanish. So for those agencies that are serving families and families that speak Spanish, this workshop, Know Your Rights special education, is totally in Spanish. I put the link out there so you guys could send it out so families can register. If you have any questions, you can call our main number, 212-244-4664. If you have questions for me about this particular workshop, you can actually share my email, which is pmartinez-boone@NYLPI, and I'm typing the email right now because I know it's long. So that's it for me. Thank you, everyone.
Not so fast,
Yeah.
the young lady.
We have a question for you.
There was a question on my chat, but I have the last person that spoke. Can you, from Nigeria, can you also please retype your phone number? Somebody's asking. Question for you, because there's a question for you, Paola. They're asking, are you guys going to be doing an English workshop?
We already had the English workshop this month, unfortunately, but we usually have then a spring, fall, so probably we're gonna put another one together in October. So I participate in these meetings all the time, so I definitely will send the invitation when we have the English one. So I'm sorry.
No one's complaining.
But now we have in the Spanish one just to serve our Spanish-speaking families.
Okay.
Thank you for the question.
No, I have a question, Paola.
Go ahead.
Okay. First of all, I'd appreciate if you do me a big favor. Send in a separate email your flyer in Spanish, but about this workshop, but also your flyer in English, and when do you usually do these type of workshops? It would be a very big help, because I am not going to try to attempt to write anything in Spanish, even though I understand a bit. I'm not going to embarrass myself, but it would be a very big help for the families too.
Absolutely, will do. I do have them. I just didn't want to overload everyone, but I do have them. So I will send it. Chris, do you want me to send it to Chris?
The advisory.
The advisory.
Okay. The advisory one. That's what's on. It's right here on the top.
Yeah, and that
it will be easier, because then what I do is, and I'll say this, I'll just repeat that. It's easier to send it to the advisory email, because then I put all the stars up, and then when I see my lineup, I will then use my special cut and paste moment and make sure that all the information, because Paola, you do have you're also on our advocate page, but when you have trainings or a training or a meeting coming up, I put that in the events page and the training page, so therefore people see it. So that's why I want to make sure that all that information goes to the advisory email.
Absolutely. Thank you so much, guys. I will email it to you.
You're very welcome.
And Paola, you also have homework too. Please, Pat, make sure you forward also the families the Omni thing, because we want to make sure in all languages everyone understands that, there's nothing to rush on that, because I know your colleague who also works with me at ACTA will agree with me, and we want to make sure everyone gets the right information and how to work together.
Absolutely, will do. Thank you.
You're welcome. Thank you.
Thank you. S. Torres.
Hello, are you there?
S. Torres. I'm gonna click on her, and if
Nice. Toussaint.
Toussaint.
It's Toussaint. Are you here?
She's there. It just said. Okay. Orlando, do you have any additional announcements for Brooklyn community? And also Block, if you have a moment, also if you have an announcement.
Not at this moment.
And I thank you again, Orlando, as well as Block. I thank you both for answering all those questions and presenting. Appreciate it very much.
I know Rose Saul was here, but she had to run. But at this moment, it is important, everyone, to please get that information out for housing. Especially, this is a good time to do this. And please remind your elected officials to still show the money. As I say that, I think we all agree on that. Is Block Institute still with me? And I always, because at least.
Yes, I'm here.
Do you have an announcement for Block since you're here?
Any other announcements?
Just the housing opportunity. Check it out.
That's good. But can you, between the both of you, can you guys please put on your what's the website for the those agencies, which they should go for service openings on the chat? So therefore, I can just cut and paste it later on. Thank you.
Thank you again for speaking
today.
today.
Hold on, we have Jenny. Is that Jenny and I'm seeing? Jenya A. Okay. Oh, I see. Thank you, guys. Okay, for the last time, I'm just going to double check. Does anyone else have an announcement? Let me check the phone person, which I'm going to unmute. 718-646. You're off. Hello?
Yes, hello. Now it's Ursula from Family Connect.
Hi, Ursula. Do you have an announcement?
No, thank you.
Okay.
Glad to hear your voice, though.
Glad to hear the voice, Ursula. Send me a postcard.
Yes, I will. Have a nice day, everybody.
You too.
You too.
Okay, since no one else have an announcement or anything you need to bring up, otherwise we're going to move on to say to everyone, as a reminder, everyone, please email you at that email which you just saw me shaking my thing up a storm, which is important because then I update it by this
weekend, as you know. We will. Okay, I want everybody to remember that we need all your service opening, training events, and news updates must be emailed to us.
No later by this Friday.
Because, and then the website goes down when we put it on, and then we put it back on. So please don't get upset on the weekend if you try. That means we're updating the website.
And there's a notice that pops in that will say website being updated. Means I turned it off. That means I am updating, making sure there is nothing wrong. So please don't be worried or concerned.
Don't get upset either. We are taking it seriously, but we do need a day to put it on. Thank you.
Let me remind everyone, as this is the final moment, a reminder. Remind you, our next joint meeting, because we're not meeting in September because of the Jewish holidays. Our next meeting is in July 21st with the joint meeting of both councils. And as I said, as Joyce and Debbie agree, it is going to be the evening. We will start the meeting at 6 p.m. sharp. We asked everyone try to be on by 5:30. So July 21st, pass the word out. This is a good opportunity for everyone to please attend. And I say the word, everyone. And remind you, Omni is around that corner as well at July 14th, which is the first one first. As I said, we will have maybe possibly a special guest stars, which I am not announcing. The only ones you see here are the names. They will be there to help you if you have any additional questions or concerns. Remind you, if you have a complaint, we will have the chat open. Please do not put your announcement during the July 14th Advisory Council Update Reduced Fare Omni presentation. So please make sure that if you have any concerns and questions, you can bring them in. But please, everyone, this is not an announcement time during that day. And a reminder, as I said earlier, please make sure you visit our website. If you have, and our email does tell you when the next meetings are with the Ring Central code. And remind you, the new location for the DDRO and the advisory are 750 Vandalia Avenue. Please, at this time, to email if you have any additional things you need to add into our website. As you see, our website is running fine and running good and strong. Since no one else has any additional questions, I thank everyone. Please enjoy the 4th of July, and to remind you, fireworks are illegal. If you see them, please contact 311. If the fireworks do go out of control and you see a fire, call 911 on that. So on behalf of the advisory council, on behalf of the Brooklyn DD Council.
And on behalf of the Brooklyn Family Support Service Advisory Council, we all say thank you for coming to the meeting. We all say have a safe 4th of July and also enjoy your summer. And we'll see you on the 14th and the 21st. Thank you.
Thank you, everyone. And have a great weekend. And happy 4th of July. And please be safe. Bye, everyone. Bye.